And we're back with Dr. Suresh Nagapan from Cone Health. He's discussing keeping your kid healthy and COVID-free as the school year approaches. And again, we are taking your text questions. So this first one that I have here is, what are the main differences between the two vaccines that are approved for children?
Good question. So there's two brands that probably everyone has heard of now, the Moderna brand and the Pfizer brand. Both those are actually approved for kids 6 months and up. And to be honest, there's not a huge difference between them. So, if you go to a vaccination site and they've got one but not the other, I would get whatever they have. They're both excellent vaccines. They're both use really similar technology, that mRNA technology. They both work really well, very similar efficacy. So really either one is good.
Any difference on side effects or anything from either one?
Side effects are about the same. There's some slight differences in the number of doses depending on your age. But other than that, they're really very similar.
Okay. This next question is, should I wait to vaccinate my kid until new vaccines become available? Maybe ones that have more of the different variants in them.
Yeah, so the plan, at least now, is that in September that a more Omicron-specific vaccine is coming out. It's hard for me to say quite yet whether it's worth waiting for, just because we haven't seen the data about that. And before I really make a recommendation, I like to chew over that data and know for sure, is it really better? Is it really going to have some beneficial effect? I would say, if you have the chance to get it vaccinated sooner, I probably would take it, because again, our big goal is to get, prevent serious illness. And the old vaccine and the new vaccine are going to do that just as well. So if you're focused on that, either one should be fine.
Okay. All right. This next question is, should my child wear a mask to go to school if they go to a school in a county with high spread, even if it's not required to wear a mask?
Yeah. So, the mask rules are going to be very different this year than in past years. I would say that's a really, in many ways, a personal decision. You're always safer with a mask, and the mask does make a difference. We in the hospital, we wear masks all the time in the hospital. We've been wearing masks during the whole pandemic. We take care of lots of people with COVID. We're up close and personal and stuff like that. And really, we haven't seen any physicians or our hospital workers get COVID from patients. So that just tells us the masks work really well. So, if your child can tolerate it and it's not a big burden for them, I think it's a reasonable thing to do to wear a mask, even if the rest of the school is not doing it.
All right. So I know once kids go back to school and stuff like that, there's going to be probably a few, outbreaks here and there of COVID. And we always get these calls where parents say, okay, there was an outbreak, but the school's not shutting down. What are the new rules when it comes to quarantine and all that?
Yeah, so the CDC just put out some new rules about quarantine and isolation. Came about 2 weeks ago or so. And it's really updated things. And it's trying to reflect that, 2022 is different than 2020. We're in a really different spot than we used to be, right? So if you add up all the people who've had COVID and all the people who've had the shot, you've got 90% of people who've got some form of immunity to COVID. So we're not nearly as vulnerable as we were at the beginning of this. And so because of that, we can be a little more relaxed about what we do. So you're going to see this year, what the CDC is recommending is that if you're exposed, whereas before sometimes we would recommend quarantine, that you would stay home if you were exposed. Now you don't have to do that. Now you can wear a mask. You wear a mask for 10 days. They still recommend that you test if you're, especially if you have a close exposure. And the ideal thing to do is test multiple times. If you test too early, sometimes you can miss it. And so you want to test, maybe a couple days apart, do that 2 or 3 times. If you do that, you test negative throughout the whole time, you don't have any symptoms, make sure to wear a really good mask for those 10 days, you should be good. And so that really changes things in schools, because now that every time there's a classroom exposure, the whole school doesn't have to shut down, the classroom doesn't have to shut down. And honestly, I think that's really important because kids have in some ways borne the brunt of this with school closures and activities closing down and missing out on sports and missing out on friends. And I think we've got to look out for their whole health. COVID is important, but we want to make sure that their mental health is okay, that they get to connect with their peers. And I think these new rules are going to go a long way towards that.
Mm-hmm. Okay. All right. We are continuing to take your text questions. The number is 336-379-5775.